everybody. I'm Paul Landesman from the Health Connector, and before I begin, I do understand that you might not be able to hear very well because we actually have an air conditioning vent just above us. So I do apologize in advance, but the people with the fans couldn't get here on time, so we have to use the air conditioning. I'm going to talk about, as you can see, from now for about half an hour to look at consumer support and the various types of consumer support that are out there working along with you. And as you can see on page 2 of the agenda, we'll look at an overview. And Nick actually talked a lot about what your role is, the certified application counselors, and I'll just touch a little bit more on that. We'll look at the navigators, the outreach partners, brokers, customer service, the public information unit, the PIU.
Hello? Paul?
Yes, can you hear me now?
Yes.
Okay. All right, so basically, as I was going through the agenda, we'll be discussing the role of the PIU, the Public Information Unit. There'll be some example questions for in terms of dealing with individuals and families, which will be the focus of working with the Certified Application Counselors' work. And then also, the last bullet talks about assessment, summary, and resources. The assessment questions are there. We're not going to go through them for the sake of time here, but you as the trainers can go back and work with your fellow certified application counselors to, when you train them, to use them as part of your review process for them. And I will discuss the resources because there's some very important information there. So basically, slide 3 just talks about the learning objectives, what we're going to do today, providing a high-level overview of the different stakeholders that are available to provide consumer support and assistance with both health and dental enrollment, describe the types of stakeholders that are going to be providing consumer support, and compare the level of support that each of the different stakeholder groups, which are the different types of consumer support, can provide for consumers, which leads us really into slide 4, which is a description. It's an overview of the different stakeholders on the left side. You can see them: the navigator, the certified application counselor, outreach partner, broker, customer service, and the PIU, and the description for each. And I just really would like to highlight the difference between a navigator, or what a navigator will be doing, and a certified application counselor. Nick already mentioned what a certified application counselor will be doing. Navigators are organizations and people within those organizations that are certified by the Health Connector to help individuals, families, and small groups prepare electronic and paper applications to determine eligibility and to assist with enrollment for coverage through the marketplace. They also provide outreach and education about the marketplace. And that's really one of the big differences. Navigators are, again, it's also mandated by the ACA and also part of the agreement that they've signed with the Connector to provide outreach and education, a minimum amount of activities per month that they have to take part in and report back to us. Whereas certified application counselors, as you know, you provide assistance with health and dental plan enrollment for individuals and families. CACs, or certified application counselors, are trained and certified by the Connector, but you do not perform outreach activities. It's not part of your requirements. The outreach partners are organizations that are selected by the Connector to assist with outbound communications and to educate individuals, families, and small groups on health insurance options. They do not perform enrollment. You may be familiar with the role of brokers. They primarily support small group or employers in selecting, enrolling, and managing health insurance plans for their clients. They also have the capability of working with individuals and families. You're familiar with customer service representatives. Both Mass Health and the Connector have customer service centers. They have the sufficient capacity and training to provide all levels of consumer support to non-group and small group. And they also provide shopping, eligibility, enrollment, payment, and account management support to to the consumers who do call them. And that, lastly but not least, our public information unit. This is something that the Health Connector had in place back in 2006. I'm dating myself. 2006, 2007, when it was formed. And this is basically We found it very, very helpful in managing when there's a lot of change, just having a point person or a team that manages policy-driven education and inquiries that are related to the ACA and the Health Connector. And if you've been to any of the MTS in the last few months, you might have met Joe Rich, who we brought on to be a part of our public information unit. And he works with Nina Dubison, who also has been an ongoing member of our public information unit here as well. So as you can see, we have a multi-pronged approach to consumer support throughout the Commonwealth of Massachusetts. On slide 5, you see a more detailed description from what Nick gave you of the role of the certified application counselors. If you want, I can call you CACs, or if you don't want, I can say the long term, but I won't use the acronym. Basically, your target audience are individuals and families. And examples of certified application counselors, as you probably are aware, are community health center enrollment staff, hospital enrollment members, and consumer nonprofit organization employees. The funding for certified application counselors do not receive funding from the Health Connector to perform this service. Otherwise, the description is as we mentioned before and as Nick said also. Navigators, briefly, again, I'm not going to go into too much detail. Just the description on slide 6 is, as we said, so basically the navigators are no wrong door, and again, that's ACA mandate. They should perform. Anyone that walks in the door, the navigator should be able to assist, whether they're an individual, a family, or a small group. So their training is a little bit more extensive because they have to be ready to help anybody that calls them, that connects with them in some way. Navigators, as you see in the note in the description on page 6 there, the law states navigators cannot recommend plans. So they can assist, they can help people look but they cannot make decisions for people, for the consumer. In our first year, the focus will be on assisting individuals and families, and in some cases, small groups who will experience changes in their coverage options. For example, we have existing Commonwealth Care, Mass Health, Medical Security Plan, and Health Safety Net members that may be transitioning into new affordable coverage options. Again, people whose plans will be changing are getting noticed. They're getting notices. So just as a certified application counselor, be aware that you may be contacted by people that may have received a notice or a letter from an agency, Mass Health, from the connector saying something's changing, so they might not really understand, or they may understand, and they may be seeking your guidance or your assistance with that. We're also focusing this first year on populations that are newly eligible for individual and small group healthcare tax credits and other subsidies, as well as the non-subsidized population. So examples, again, we've selected 10 navigator organizations, and I'll go into a little bit more detail in the next slide, so you can see on slide 7 for the full list. And also note the funding that navigators are not eligible to receive commission. They are funded through state grants that are administered by the Health Connector. If you go on to slide 7, here's the list of the 10 navigator organizations and a map that shows the general coverage of the general geographic coverage that each of those navigator organizations covers. And just so you know, there was a very thorough and complex grant application process that we went through at the connector with Mass Health, and we awarded $1.1 million in grants to 10 different organizations that cover 10 different geographic locations across the Commonwealth. But these, you might look at that map and say, well, I see some white space there, and yes, you might see some white space, but again, because there's no wrong door, someone from an area that's near one of the navigators can actually call them and assist them. So it's not like there is no coverage in terms of navigators. Navigators are ready to work with anybody that contacts them. Moving on to outreach partners. These actually will be assisting us by providing public education communications to individuals, families, and small groups about the ACA benefits. An example of this is Healthcare for All. This group, these partners are selected by the Health Connector to assist with grassroots public education, which basically not only not only supports them, but it actually complements the education activities that are going on, as you know, with the MTS, with other outreach and education programs that the navigators are doing as well. So they will provide geographic outreach in areas where navigators are not located, but will have information on the nearest navigator, as well as possibly the nearest certified application counselor. But again, many people in the areas may already know who their nearest certified application counselor is already. So we're lucky we're in a state where there's a fairly high level of understanding of the resources that are out there. In terms of funding for outreach partners, these are funded through the Health Connectors Establishment Grants. Brokers on slide 9 you may be familiar with. Again, they largely support small groups, which is up to and including 50 employees, to help them to enroll in health and dental coverage. For a list of brokers, you could go on the list. The Massachusetts Division of Insurance, the DOI, has a list of all brokers and brokerage firms that are registered with the connector. And their target audience is primarily businesses, but they do have the capability to work with individuals and families. And we work with the business development team here at the connector, who work with the brokers, and we meaning the staff here at the connector, also provide training for the brokers on the different areas of ACA and navigators, CAC, as well. And again, just a note in terms of the funding for brokers, as you can see at the bottom of slide 9, when they're selling health or dental insurance outside of the connector, brokers are paid on commission based upon the sale of the health and or dental insurance product. When they're selling either of those products within the health connector pays them a per subscriber per month commission. So that's just how it's broken out for brokers. The customer service, I believe you understand, they're really the front line for consumer question or issues and are trained to handle most inquiries. The examples, again, of who would be contacting them would be Health Connector employees or contractors. Sorry, these would be the customer service people who would be calling them. General public. Let me just say that a navigator would not be calling them because navigators should have the answers. So there, as navigators and certified application counselors are as frontline in terms of consumer questions or issues, which you, as certified application counselors or as in your current positions, you may already be doing that, or you and your people may already be doing this as well. Serving, you're trained to handle almost all needs. But the CSRs under the ACA, you'll also help refer consumers to other assistance groups such as navigators, or the certified application counselors as needed. So the customer service reps will also have sufficient capacity and capability and the training to provide a lot of support to both non-group and small group marketplace populations. And again, they'll be able to provide eligibility, shopping, enrollment, payment, and account management support to customers. So yes, if a consumer calls up and wants help from a customer service rep to help them with their enrollment, they should be able to do that. That's something that might be different from today. Moving on to slide 11, the public information unit, as we talked about, their target audience would be the public, which could be individuals, families, small groups, the legislature, other state offices, and federal agencies that are looking for information, or they have inquiries regarding education and information related to healthcare reform, the connector, the ACA, and again, as I mentioned earlier, it's healthcare staff, and members can, if someone wants to contact the public information unit, they would just call the Health Connector's phone number, the 1-877-MA-ENROLL. As you can see there on slide 11, it's 1-877-623-6765, and select the option to talk to the PIU. Moving on to on slide 12, where we're talking about assisting individuals and families, some example questions. And basically, we're looking at what is each stakeholder's role in assisting individuals and families. I've mentioned this already. Brokers, as we said, this is slide 13, brokers can provide answers to general questions for individuals and families, but primarily serve small groups, small businesses. Navigators and certified application counselors can answer most questions to assist individuals and families, with general, shopping, enrollment, and account management questions. The outreach partners, again, are trained to assist with communications and provide answers to general, eligibility, and some account management questions, but cannot provide enrollment support. So they would, again, they could refer someone to a navigator or a certified application counselor for further assistance. Customer support reps, they can answer most questions related to the individual and or the family's experience in the connector. And the public information unit can answer general questions, policy questions, and questions about the Affordable Care Act and how it affects individuals and families. The following slides are basically, you see their tables, that's slides 14, 15, 16, and 17. They basically go into more detailed questions and which of those stakeholders would be able to answer questions. For example, you can see on slide 14, the first general question, if someone has a general question, what's the QHP, what's the premium tax credit, you can see that every one of our consumer support stakeholders should be able to answer that question. It's pretty much, you can see across the board that if, in terms of general questions, everyone should be able to answer all the questions. There is one you see, the third from the bottom, about ID card status. Where's my card? Where's my family's card? Right now, that's really a broker question, but after January 1st, all the other, and again, there'll be more supporting information. As Howard said, we have your back. We've got you covered. There'll be more guidance after January 1st. There'll be more specific information on that. The next slide, 15, talks about eligibility questions. Who would be able to, for example, if someone has a subsidy question, what subsidies am I eligible to receive? Well, basically, you can see that CACs, navigators, outreach partners, and customer service should be able to assist with those. And basically, a navigator would be able to, and a customer service, because they can actually go in and assist the person, and they can see when they're in the marketplace online, going through the eligibility and enrollment process, the information would be displayed in that. So that's where that information would be available to someone who is assisting a person. In terms of application and plan management questions, slide 16, again, pretty much, if you look at the first question, selecting a health insurance plan, what plan options are available to me and my family. Again, anyone that will be assisting an individual or family within the system, such as a broker, a certified application counselor, a navigator, customer service, will be able to see the plan options that are available when they're going through the process online. If someone has a question about how do I change my PCP that I previously selected, again, a broker, customer service should be able to help them with that. Again, these are just some generic questions that we've developed, and then you can go in more detail with your colleagues back in your offices. And on the last slide, where we're looking at account management or administrative questions, again, a little bit more specific. If someone needs help with the online process, how do I browse through the website? Again, it could be a certified application counselor, a navigator, customer service, or the public information unit. A very general question. How do I get to the website, and what do I need to do first in order to get the process rolling? If someone has a question about changing address, how to change their address, again, they can go to someone for assistance. They'll be able to do it themselves, provided they would have set up an account. And again, so anyone that has access, for example, a certified application counselor, navigator, customer service, the public information unit, or outreach partner would be able to assist them with giving people that answer to those questions. And the same thing for, how do I pay online? What's the process? Those same stakeholder groups would be able to assist an individual with those questions. Policy questions, as you can see, if there's policy questions, again, that would be, you would direct those to customer service or the public information unit, because as we mentioned, public information unit is focusing more on policy. They've got the pulse on policy questions, because as you understand, policies being updated, refreshed basically every day on a day-to-day basis as we're speaking. And you know that once there's updates, we will get that information to you, whether you're a navigator, a certified application counselor, or whomever. We want to make sure that you have the most up-to-date information as we have it. And on slide 18, basically, this last slide talks, well, not the last slide, but it says, when should Health Connector stakeholders refer questions? And we've kind of already talked about this too, is that any of these consumer support groups should transfer non-group questions, that's individual or family questions. If someone's got a policy or an ACA-specific question, they would refer them to the Public Information Unit. Any additional questions that a certified application counselor, navigator, or broker, if they cannot answer, they would refer to customer service. Again, customer service, the front line, they would also have the most up-to-date information. The next few pages are the assessment, and again, we're not going to go through them now because I can't see you when you raise your hand to answer the questions, and you're all on mute. You can tell I used to be a teacher. And basically, I just want to refer you to slide 24 and slide 25. Slide 24, if you are not already familiar with these online resources, these are some, we have mahealthconnector.org is the Mass Health Connector website, as you probably already are familiar with. Healthcare.gov is the official federal consumer site for the marketplace. Has an incredible amount of consumer-friendly material that are very easy and to understand, well written, and can be printed out and used for the general public. It's very, very, I use it a lot, and I know some of the Navigator organizations are also using some of the materials they found on there because, again, as you know, in Massachusetts, we're in a little bit of a different situation than other states, but there's some pretty generic, some good generic information about the ACA, what does it mean. We also have, from the Health Connector, we've come up with some other consumer support materials that are available through our website. You can also see that on the resources we have a social media site on Facebook, so you can friend us on Facebook. And if you want to tweet with us, you can see our Twitter link right there. I don't tweet, so I just talk. And last but not least, very important on slide 25, when you don't know where to go to, where to call, and you don't need to call Howard or somebody else, just whoever, you know a name and you're like, oh, I'm going to call them. This is something that the hours, the website, the phone numbers of where to contact, who to contact, where to, addresses for mailing in things, if you have general inquiries, premium payments, if you need to mail them in-person servicing locations, the connector. Our customer service, we have 2 walk-in, in-person servicing locations, one in Boston and one in Worcester. We will. And again, this information is really, really important for you and for anyone in your organizations that you're going to be going back to train. Because there's so much information, there's a lot that's going on, and just to make it easier for all of you, I take this and have it up in your cube, in your office wall, so if you've got a question, you know where to go to. And that basically wraps up my portion on the consumer support.